Hi everybody, today we're going to be demoing how to change a PICC line dressing that has the Statlock device on it. First of all, I'm going to start off by walking into the room. Got my hand sanitizer. Hey Manny the mannequin, how are you today? We're going to be dressing your PICC line again. You're due for a change. So I'm going to start with my assessment of my PICC line. First of all, I'm going to be looking at the state of the dressing. Is it clean? Is it dry? Is it intact? And am I going to need any extra supplies as I'm changing it? So I'm going to start by looking underneath that CHG patch. First of all, is it looking boggy? Is it really wet? Does the patient sweat a lot? If they have a lot of edema, is there a lot of moisture under there? Also, is there any blood, extra exudate? Is there old Statlock or Stat Seal underneath there? If there is, I might consider bringing a couple of extra things in. If it's looking really gross and really junky and there's a lot of debris, I might bring an extra ChlorPrep so I can clean more with it. And of course, if the patient's bleeding a lot, if they have a lot of oozing, or if they have serous drainage from the site, I might consider bringing some Stat Seal when I redress it to make sure that it's not getting bloody and I'm not just gonna have to change it again tomorrow. All of your ICUs on the various units should have Stat Seal available. If your unit doesn't carry this, that always has it, and so you can page us and we'll bring you some and teach you how to use it. This stuff is sterile, even though it looks like dirt. It's a great way to help secure up your PICC line to make sure that it's not bleeding everywhere. It's also really good in your patients who have low platelet count or who are otherwise on blood thinners. Other considerations you might want to make: if your patient's allergic to CHG, the next step would be betadine, or you can use these providone iodine swabs. Providone iodine or iodine-based cleansers still have some antimicrobial properties. They're not as good as CHG, but they're better than alcohol, so this is your next go-to, even though it makes their skin yellow. All right. Secondly, before I even get started, I'm going to look at what our external length of the PICC is. As you guys probably have already experienced with the Statlock device, sometimes you might have migration of the PICC. This isn't a huge deal as long as you're not pushing the PICC back in. Pulling it out a tiny bit is not going to kill your patient, nor is it going to ruin where this is. So if we look really closely, we can see that there's some tick marks on our PICC line. This 0 mark is actually the intended 0 point per the manufacturer. So if you see a PICC line that is inserted to that 0 point, even though there's an extra centimeter of length out, that is actually the 0 mark. So when you see it charted in the flow sheets by that, it's going to be at 0. We may put in the comments that there's 1 centimeter if you exclude if you include the expected external length. This one, you can see there's an extra tick mark. So in the flow sheets, this would be documented as an external length of 1 centimeter. Now, there may be a rare instance where your catheter may be hubbed, and so it may be inserted all the way, including the expected external length. In these patients, it may be charted in the flow sheets as -1. I know that's really weird, but the use of the tick marks makes it a lot easier for you to identify have I pulled it out or not. So if you do see anything wonky in the flow sheets, you're welcome to call that or page us to clarify. All right, my PICC line is looking actually pretty pristine, even though we're due for a dressing change today. So I don't know that I need to gather any extra supplies, but I am going to go ahead and get everything I'm going to need for a Statlock change. Before I leave and go do my dressing change, we are going to do some cleaning first. All right, so now we're going to go ahead and get our work surface clear before we go gather up our supplies. This is going to make sure that our table has adequate time to dry. As you know, with our cleansing wipes, there's varying drying times. So we're going to clear off all of the patient belongings that are on the table. And of course our own. We want to have a totally clean work surface since we're getting ready to do a sterile procedure. And if you are using purple wipes, you're going to wipe down and you're going to wait 2 minutes. That's the contact time for drying per the manufacturer. If you're using the bleach wipes, the contact time is 4 minutes. So just make sure that you are making sure that that's totally dry before you start and that you've waited the appropriate time for the manufacturer. Now that that's done, everything's wiped down, my table's drying, I'm going to go gather my supplies and I'll be right back. All right, now I've got all of my supplies. Hopefully my contact drying time is up by the time I come back. If not, I'm gonna make sure that I wait before placing all of my supplies on that surface. And before I do, I am gonna go ahead and remove my central line kit, at least from this outer bag. This bag is pretty nasty. It does make a lot of contact with a lot of things on its way up. So you're gonna wanna just remove your supplies from that bag before you even get started. Your saline dropper, you're gonna kind of set this aside. You're gonna use that potentially while you're removing the dressing. And I'm actually going ahead and open up my central line dressing kit before I even get started removing the old one. And this way, my kit is ready to go almost before I even get started. And so I'm gonna stop here, making sure that my hand sanitizer is ready to go. This way my field's still covered and I'm not in danger of breaking sterility on the things that are really important in this kit before I start. All right. I've got my other supplies. I'm just gonna set them off to the side while we get started removing the dressing.